As an American, for years we've known that our public healthcare system has been a joke. The Affordable Care Act was a step in the right direction towards getting all Americans health care, but we still need to work on and make secure a system that will give every single American health care while also giving them the ability to choose and pick from different packages. We have a system right now that they think will eventually fix itself. Americans lie to themselves every day, as in this picture. They try to convince themselves that it will change without putting proactive thoughts and laws and putting politicians that support change. If you continually ignore the problems, they will never actually solve themselves. You have to proactively work towards solving the problem. At the current rate, a good portion of Americans are not able to afford the current health insurance premiums, package prices, or even the care at all. This is because the disproportionate wealth at the top of America has created private healthcare plans that benefit the rich but do not benefit the poor. A basic healthcare plan must be implemented in order to reinvigorate the system which is currently failing. As a country, we spend the highest per capita, according to the OECD health data graph provided, and also the Internal Medicine Journal. We spend more than Switzerland, Russia, Canada, Norway, and Germany, who all have universal healthcare systems that they use to great effect. Their individuals are covered. Ours aren't. What can we do to fix an issue? And I think the solution is right in front of our face. Create. One of the greatest ways to tell a critic of the basic healthcare system is to show them the facts. South Korea had a private and a public healthcare system, and according to their data from their national website, has shown that they've lowered premiums, higher the insured rate, and become a country that is now one of the considered the most medical powerhouses. If we follow their prior and now their systematic development of their medical programs, we could easily show how we could benefit and become just like them. We pay more for insurance than any other country. We're working against the grain. We have an inflation rate that is constantly going up and down. We do not know how to fix it. We have to follow the mold of countries in the past, as said before. We have to use credit plans like Hillary Clinton's proposed on her website. You can look that up. It's on Hillary Clinton's website. It says we could just offer a tax credit for families who cannot afford it. Or we could use the Obama Affordable Care Act. This is a stepping stone. It has now lowered the amount of uninsured Americans from 49 million to 25 million. That's according to JAMA, the personal website. It shows that the United States healthcare can be reformed. We just have to work for it. Even though, as you see, Obamacare has increased the enrollment of health insurance in America, there are issues such as the New England Journal of Medicine has brought up. People that make over 200% of the poverty level are paying way higher prices, $11,000 or $20,000 for a family of three, in exchange to the other types of families who are only paying thousands of dollars, but receiving much more care. The new healthcare system has to be innovative. It has to be working towards Americans. It cannot only work towards poor Americans. Republicans and Democrats have to come together in agreement for a situation that they can both understand and be in line with. It has to create a baseline of service for individuals to be understood of what they're being offered. If someone's not allowed to go to the ER without being charged $5,000, they should be able to know that. It also needs to create a basic benefit for all taxpayers to get it the same way education is divvied out in the United States. As a united country, we can come together. We can continue success by supporting and including initiative towards local and global law. We want to introduce tax credit, as Hillary Clinton said on her website. We want to have healthier and stronger workers by having them allowed to use healthcare. These benefits would support and help the American economy. More workers, credits allowing people that pay more for the healthcare to be relieved, and to be able to support this initiative would be the most important part of the whole thing. We need to keep together and understand that it is important to help the fellow Americans.